It's the problem that most people have, right? They think that my blood pressure's okay, but you're on medication. Blood pressure's not okay. You wouldn't need medication.
What do you recommend? You've talked about the dangers of statins. What do you recommend for people with high lipoprotein A? Do you ever advise CoQ10?
Yes, I recommend everybody taking a statin uses CoQ10. Because obviously the statins deplete the body of CoQ10, but CoQ10, also known as ubiquitone, is present. It's the word ubiquitous means universal. In other words, it's not hard to find that in our food supply, and particularly we're on a high green vegetable diet, so we're really making a lot of CoQ10. We're getting it in the food, the precursors in the food. We don't really need to take it. We don't need to take it. We're so healthy, but on the statin, they should be taking that CoQ10. So you're saying an apoprotein A responds to this comprehensive nutritional approach. There's even a study on that. And so we do see some improvement in apoprotein A. But there, like was said earlier, I'm talking in generalities. When you're dealing with an individual case, you sometimes have some very unusual conditions with people with severe genetic defects or differences, and in some people it may be appropriate to use a statin or use a drug that would help lower that. But in most cases it comes down, and keeping in mind we have multiple risk factors. If this diet is so excellent and your LDL is not oxidized, then if your apoprotein A is a little bit elevated, it's not a significant risk factor because it's just the one thing you have a little off and everything else is so good. But if the apoprotein A is elevated with the high cholesterol, with a bad diet, then you have a higher risk. So don't be too overly concerned if you just have one thing that's not perfect, if everything else you're doing is so good, including having normal blood pressure. I tell people this. I say, look, I'm giving you this kind of like promise or expectation that you're not going to have a heart attack or a stroke. Now I'm saying you eat this way, you're not going to have a heart attack. But that promise is only valid if you eat and exercise regularly so that you have a normal body weight and you have a normal blood pressure without drugs, and you have a normal cholesterol without drugs, and you have a normal exercise tolerance. And so in other words, I'm saying get normal, and then you're not going to have a risk. So if people are just thinking that they're going to normalize their blood pressure with drugs, then you're not going to be out of risk. Highest degree of protection you get is when you've fixed yourself and normalized your parameters with food and with exercise, because then you're not just covering it up with a drug and still have something wrong with you. You're covering it up with a drug. It's the problem that most people have, right? They think that my blood pressure's okay. But you're on medication. Blood pressure's not okay. You wouldn't need medication.